Great. Well, thank you. Thank you everyone for joining us for the final Learning Network event of this school year. It has been such a pleasure to facilitate these events with all of you over the past year. We're really focused on looking forward, anticipating the needs and resources for next school year. Before we start, I do want to thank all of our partners, OSPI, DOH, all 9 ESDs. This has been the ultimate team sport to support schools in supporting their communities through the COVID-19 pandemic. Next slide, please. Great. Jam-packed agenda today. We're joined by Martin Mueller, the Assistant Superintendent of Student Engagement and Support at OSPI. He's here just to share some words of gratitude. Folks who have worked with me for a while know that I like to open with gratitude. It's important that we remember all of the hard work and that there are things to celebrate from these past few years. I have a couple of housekeeping things for summer, knowing that some of you will be doing testing over the summer, some of you will not. So just a couple friendly reminders that I'll roll through for this group. And then really the stars of the show today are Heather Drummond and Michelle Chung from the DOH testing team. They've prepared a presentation for all of you in which they will introduce the resources for next school year. And then we'll do a Q&A session with them in which I will review the questions that folks submitted ahead of time, and feel free to drop questions or reactions in the chat. Finally, at the end of the Learning Network today, I'll present a year in review. We have collated all of our data from the past year. Just thought I would share out some pretty amazing work with all of you, celebrate the hard work and the impact that all of you have had on your school communities over the past year. Great. This event is being recorded. We will send the recording and the slides out ahead of time, so no need to take detailed notes. You will have access to this afterwards. All right, Martin, thank you so much for joining us today. Would love to pass it over to you for some words of gratitude or any sentiments that you'd like to share, both personally or from OSPI.
Thank you, Sarah. I appreciate it, and welcome to all of you. I'm glad that you joined us today. I extend warm appreciation from Superintendent Rakedal, who I was with earlier this morning, and you know, we're just so profoundly grateful for the hard work that all of you have engaged in. We started, you know, kind of last summer, about this time last summer, operating under the premise that we really wanted to have our learning experience for the 21-22 school year as much as possible in person. And, you know, we by and large accomplished that. And it's through your effort and perseverance across a number of different fronts, including a lot of what we're going to talk about today with school testing. So much gratitude for everything that you all have done to be creative, I guess. You know, this virus has zigged when we thought it was going to zag, and zagged when we thought it was going to zig, and still is, really, you know. And so it's forced all of us to have a profound amount of adaptability, to think creatively, to really you know, kind of focus on that goal, and so really appreciative of all your hard work. Also really appreciative of the great partnership that we evolved over the last year or so on this initiative, the great work that Health Commons has done, you know, facilitating so much of the connection at the local level. You know, certainly DOH with your expertise, coordination, resources, and just an innumerable tangible and intangible support to the overall health and safety of our communities and our schools. And so we're just incredibly grateful for all of the leadership that you provided. And the ESDs, you know, so our ESDs have profoundly stood up in a number of different ways over the course of the pandemic. And, you know, kind of got introduced as playing maybe an important role around school testing, COVID testing, regionally in that great ESD role, and then have just evolved and really risen to that challenge. And so I think the ESDs will have a great partnership with moving forward into next school year. So a lot of gratitude, and a lot of recognition about how hard it's been, right? About trying to sort through the fog of what's happening, and what do I have and what I don't have. And certainly the Omicron spike, underselling that spike in December, January, February, really put huge challenges on all of us, and yet here we are today, having worked our way through that, while we continue to see kind of transmission rates increase, but we're working through it, right? So a lot of again, gratitude to all of you. I know we're going to hear a lot from DOH around what the context is going to look like for next year. There'll be things that we'll have answers for today, and some things that maybe we're still trying to sort our way through. But I think we'll have the things that we don't have answers on, we'll have clarity on that in the coming, few days or weeks, right? Or as we go into the summer, and we'll do everything we can to get that information out to you. I'm not sure if DOH is going to talk about the survey. We're going to try to get a survey out to you all, your district leaders and others, to learn a little bit more objectively in an organized way around your experience for the last year, how that might inform things that we can do to improve as we go through the summer and into the next school year. So do look forward to that. And we'll really encourage you to give us your thoughts and ideas. It'll be so important to how we think through planning moving into next school year. I also know, having spent a fair amount of time, my life in public education, married to a teacher, every spring and moving into summer, we're fatigued. And I think this year we're even more fatigued, obviously. And so I just encourage you all to find the space in your life to do those things that re-energize you this year. More than ever, it's going to be so important, and all of us be in that right mindset as we move into the next school year. So I'll pass it back to you, Sarah, but just profound gratitude and everything we can do to support you, we're going to work on. Thanks.
Thanks, Martin. Appreciate you highlighting two key themes there. One being partnerships. None of us could do this alone, and actually Washington State has been highlighted as a best practice model in a couple of national forums where state leaders get together to figure out how do we do more COVID testing, more COVID services through equitable access points like schools. Washington State has been highlighted as a best practice model for the partnerships between Department of Health and Department of Education. The other theme that you touched on was learning. We are all learning all the time. Even in this presentation today, we might not have all of the answers, but we'll work together to get them. Thanks, Martin. Next slide, please. Okay, switching gears, getting really into the weeds for a minute for those of you whom this is relevant for. A couple of housekeeping items for summer. Knowing some of you may do testing this summer, others may be setting it aside while you go on a well-deserved vacation. Either way, this is relevant, I think, for all of you. All of your rapid antigen tests need to be stored in a safe, secure location that does not have direct sunlight and is between 36 to 86 degrees Fahrenheit. I am expecting summer heat waves. I do not have air conditioning in my house. Please plan accordingly. Keep your tests at the proper temperature so you can continue to use them next year. As a reminder to folks, the expiration dates on your test kits vary based on when you got them from the State Department of Health. The Department of Health has issued a letter, and we can send it out after this came out during the Omicron surge. You can continue to use expired tests as long as they pass the built-in quality control that they come with. So we've gotten a lot of questions about that. You can continue to use them. That is okay by DOH. Other states have done this as well. As long as the quality control comes up positive, you can continue to use that box of tests. If you need to dispose of tests, maybe they don't pass the quality control, maybe they were overheated, you can dispose of used or damaged test kits in a regular trash bag. Keep it sealed. Unless your local health department has instructed you otherwise, go ahead and follow these instructions. For the few of you who may have those analyzers for the BD Veritor test, it's about the size of a scientific calculator. You can dispose of those in the normal trash or through your electronic recycling services at school. Really encourage you to only dispose of used or damaged test kits. If you're not doing testing this summer, don't throw it out. If it's good, go ahead and store it somewhere safe and secure, just so you have it in your back pocket if you need it. For the 100 plus school partners who are using Curative, which is a PCR-based test, you should have gotten a piece of communication from the Curative team if you haven't used one of your test sites, one of your test portals over the last 6 months. You got an email from Curative support staff checking in to see, do you want this account deactivated or do you want to keep it? If you know that you haven't used your Curative tests in 6 months and you haven't gotten that communication, please check in your spam junk folder for something from, sales support at curative.com or whatever their email is. Finally, from an inventory management perspective, friendly reminder, first in, first out. The tests that you've had the longest should be the first ones that you're distributing out to your school community. Okay, next slide, please. I know you have so many logins for so many different things, and this is just one more. Each of the testing technologies has a different portal, a different login. If you have staff who are phasing out of participating in the testing program who you need to deactivate their account, you can either email the portal owner directly, or just easier, email your Health Commons Learn to Return program manager and they'll facilitate the process for you. So think about, are there people who should not have access to test results this summer or next school year? Make a list of those so we can remove their privileges. The other reason you might need to remember these email addresses, or again, just email your Health Commons program manager, is some of these portals are deactivated from lack of use. So for example, Simple Report will turn your account inactive if you haven't been on it for 60 days. It's an easy fix, but it is a little annoying. So a couple options: you can set a reminder in your calendar, whatever, 60 days from when you go on summer vacation, 59 days, set a reminder to log in so it doesn't deactivate. Again, your Health Commons program manager is available to help you troubleshoot anything. We'll send these slides out after. Okay, great. Well, thank you so much, Heather and Michelle, for joining us today. Heather Drummond is the testing branch manager. Michelle Chung is the school testing supervisor, both with the testing team at the Washington State Department of Health. I know that you two have prepared a slide deck for this group, but I would love to start with something that each of you are thankful for, if you wouldn't mind sharing out to this group, just as a quick warm-up question, and then we can move into your PowerPoint slides. So Heather, would you mind kicking us off?
Sure. Yeah, thank you, Sarah, and good afternoon, everyone. I'm Heather Drummond. I'm the testing branch manager at the Washington State Department of Health. Really excited to be joining you this afternoon and honored to have the opportunity to echo my gratitude for each of you for the partnerships that our Learn to Return schools have had with the Department of Health. It is because of you that the Learn to Return program has been successful in facilitating more in-person learning days and reducing barriers to access for COVID-19 testing for students, staff, and families across the state. I'm so blessed to be able to be a part of this work. It is incredibly impactful. And again, that is due to the partnerships that you all have demonstrated and leaned into every day in learning something new and how you can support your communities in helping them to access necessary resources to focus specifically on learning. With that, I'll turn to my colleague, Michelle.
Thanks, Heather. Hi, everyone. Good afternoon. My name is Michelle Chung. I'm the school's testing supervisor working at the Department of Health. Just also extending my note of gratitude as well. I'm really grateful, especially the resiliency that we've seen from schools and partnering with DOH, especially in the last year. I know that the pandemic has been a learning experience for all of us, especially during the surges that we've experienced. I am a new mom myself, and so I'm learning a ton of things in the last couple of months and also understanding how important it is to keep our kids in school. I do want to thank our schools for your ability to learn right alongside of us during this pandemic in helping us determine how best to keep kids safe and schools open to maximize in-person learning. So thank you so much.
Great, thank you both. So I know that these are the slides that you've prepared for us, so we'll give you as much time as you want to walk the group through this. Afterwards, I would like to ask a couple of follow-up questions. We asked school leaders to submit their questions ahead of time. We've taken those and collated them into themes. My guess is that your presentation will touch on a lot of this, but just recognizing that all of our heads are in a million places at once these days, I may ask you to repeat a couple things during the Q&A just so we make sure it's really sinking in for folks. Does that sound okay?
That sounds great, Sarah. Yeah, happy to share a few slides about sort of where we anticipate we are heading with the Learn to Return program, answer some additional questions for you, and perhaps echo what Martin shared earlier, where we don't have all the answers yet. It is a landscape, as you know, that evolves at tremendous speed. So we are working diligently to get answers for you quickly. We understand how important it is to be able to plan for any changes in resourcing. And so really appreciate the opportunity to hear more about what you need to be successful as we prepare for the continuation of the program. This slide really talks about sort of a bit about our journey. I know Sarah will be closing us out with a reflection on the accomplishments of all of you throughout this school year, but thinking about the origins of the Learn to Return program, this began in late 2020 with a pilot of 13 schools, and it was focused exclusively on how to expand access to diagnostic testing. Since then, we've been able to incorporate screening testing as a resource for schools, starting first with access to teachers and staff, and in late spring of last year, expanding to support screening testing for students as well. Incredibly grateful to our partners at the Centers for Disease Control and Prevention, who alongside all other states and several municipalities were awarded $229 million to expand access to testing and associated resources for schools. As you all know, 85% of that funding was required to go directly to schools to support testing. And we've been incredibly honored to be able to help facilitate that process. In last month, we received the announcement that we were able to extend use of this funding to support services through next school year, concluding on July 31st, 2023. We feel incredibly fortunate to be able to continue this program and continue to work on being able to be responsive to the needs of schools and ensuring that we have resources that are able to support those needs effectively. Next slide, please. So just sort of as a high level, again, our goal is to minimize any disruptions to our school partners. So some of the things that we know will continue to be a part of the Learn to Return program for next school year include continued access to COVID-19 testing resources. We know that is probably number one for schools, is being able to have testing supplies quickly and effectively to be able to respond and increase access to students and staff. Another component of the program that we've heard and believe to be incredibly beneficial across the state are the 9 regional ESD coordinator positions who help to facilitate best practices and advocate on behalf of schools to be able to develop resources and supports for effective programmatic opportunities. Other pieces that we intend to continue are the direct labor support for in-school staff. We know that this was never a part of anyone's job description, and we understand how important it is to have dedicated funding streams to support staffing resources to facilitate COVID-19 testing and associated mitigation strategies. We also understand how important it is to continue to provide technical assistance to support schools with implementation, translation of guidance, etc. Being able to reach out to numerous people to get support and on your evolving strategy is a really critical component of the Learn to Return program that we intend to continue next year. And the final piece or pillar that we are focusing on are those communication resources that we know, again, the work of responding to COVID-19 does continue to evolve and makes the communications that much more critical to understand that evolving landscape and how it may impact operations at your school. With that, I also know that there are evolutions to the program, evolutions to your needs. Some of the things that we plan to continue to explore and understand those needs over the coming month include how your testing technology needs have changed. For example, we already know that for many schools, they really value having at-home tests or over-the-counter tests to be able to provide directly to students, staff, and families to take home as another access point and minimizing that burden on schools. Another testing component that we want to explore is where there may be value for including rapid Gnat tests, which are a type of PCR test, similar molecular tests, so that it has increased accuracy compared to the antigen test, but also has that rapid turnaround time, which enables you to do any reflex testing or confirmatory testing quickly to inform next steps for your students, staff, and families. The last piece I wanted to highlight that warrants further discussion in the coming weeks and months is the external labor support partners that we've provided. Where do they provide the most benefit to schools, and how can they be nimble to be able to support more schools effectively when there are those acute needs to get additional staffing resources to facilitate testing? I did want to highlight just some of our commitments. Again, I realize that there are a lot of outstanding questions out there. Our next slide is around some of the timelines for getting those answers. Looking forward to Sarah elevating some questions as well. But I did want to just reiterate some of our commitments at the Department of Health around the continuation of this program and the associated services. We understand that it is critical to maintain a menu of resources that can be tailored to each school and be nimble to support your evolving needs over time. We also understand, again, that direct distribution of testing supplies to your schools is critical to the ongoing success of this program and meeting the ongoing needs of your school and your community. We also understand that labor support services and technical assistance helps to minimize that burden on schools. We have heard that this was never again part of the purview of schools. And so we want to continue to identify resources that help minimize that burden on schools for facilitating this access, and technical assistance and labor support funding are two of those mechanisms that we intend to continue. And then the final item to mention here around our commitment, we see an opportunity over the next school year to increase the stickiness of the infrastructure that you all have built over the past year plus, to maintain continuity of that capacity over the longer term. We know so often with limited funding opportunities that you build something, and unfortunately the lack of funding means that it eventually is dismantled. We want to work with our ESD partners, OSPI, and all of you to think about the resources and infrastructure that we're building together. How can it be connected to other initiatives and priorities of your school, of your community, so that it can be maintained over the longer term? Okay. Let's see. In terms of a couple timelines, again, I think we understand that there are some really critical questions that folks have. I think one of the ones we hear the most about, understandably so, is around continued Fte Fund and labor funding. That is highest on our list to be able to identify what those pathways look like. Had a meeting just this morning with our fiscal team to further articulate what that looks like. And I think there are, several different components of that we're exploring and defining what that path looks like. So really expecting that by mid-June, we will have further details about how school districts that have unspent funds can carry over those funds into the next year. School districts that have approved Fte funds that they expect to expend over this school year, and how they can make staffing decisions now about continuing those resources and those staffing opportunities into next school year. Those are really highest on our list. We also, again, are committed to minimizing any disruptions around the Learn to Return menu, and expect to be able to have further details about what that menu looks like and any anticipated changes by mid-July. As we have more details, we will continue to share those via the established communication channels that you have previously received information from. We also know that there may be schools that have changing needs around Fte funds. They haven't taken advantage of that resource and see an opportunity to next year, or the level of support that you anticipate needing will evolve next year. I think those are pieces that we're looking to outline processes for and get information to you all by early August. And then just a reminder that those of you that are currently connected to Fte funds, the final attestations for spend down of those funds are due in mid-August. I just want to mention a couple additional considerations here before I have one more reminder slide and turn to Sarah. We have already heard and we continue to see that the body of work around school testing has evolved and will continue to evolve. That's where we want to evolve our resources for you. I did want to mention one additional piece for FTE funds. So as you're thinking about what your needs will look like next year, we are anticipating that the FTE fund as a whole that we're able to leverage for next school year is probably about 2/3 the amount that was provided this year. So we feel pretty confident that we'll be able to support requests, but that's something for you to be thinking about as you consider what staffing support resources you may be looking for. How has your testing program changed? How are you leveraging at-home tests, and knowing as a state, the FTE fund will be less than this year. Probably it'll be about 2/3 what we've been able to spend for this year. So that's just something for you to consider as you continue planning for the next school year. Our last slide is just another plug for yet another resource that you all are familiar with. We are grateful to the CDC for the opportunity to connect schools, camps, and other extracurricular activities and programs that support K-12 kids over the summer with accessing both point of care and over-the-counter tests. Via this resource, they have testing supplies that are available to support the whole summer. And as of now, we are hearing that the deadline for ordering is June 21st. So I think that's something Sarah may mention towards the end is, how to continue providing resources during the summer, expanding access to testing for students and families in the community, and having over-the-counter point-of-care tests as something else that can be provided may be of interest. All right, with that, I'll turn it back to you, Sarah, for any questions you want to ask Michelle and I.
Yeah, thanks, Heather. Thanks for that presentation. Also, really appreciate you sharing that timeline. I know it's not the timeline that everybody on this call wanted to hear, but at least knowing when we can expect the information is helpful. So thank you for that. Okay, folks submitted questions ahead of time. When I did some thematic analysis, my grad school professors would be so proud. I would say that there's 4 major themes: requirements and guidance for next year, closing out this year, labor fund, which you've touched on a bit, and then the testing vendors and technology and menu that will be available to schools. So maybe over this next 10-15 minutes, I'll tackle each of those themes one at a time. Requirements and guidance. Before I ask the questions that folks submitted, I do just want to acknowledge that the CDC changed their K-12 guidance and released it last Friday. I know we're joined today by Kim Sanchez as a participant, but I do have a note here that DOH has reviewed the guidance and you don't plan to change anything this school year. Is that correct?
Yeah, Sarah, that's correct. We are going to be working with our guidance team over this summer to anticipate if there's any more changes to testing requirements for next year. And we're hoping that that information will come out closer to early August. But at this time, correct, we are asking schools to reference the existing K-12 guidance that was last updated by DOH, I believe, by March 2022. So it's relatively up to date, I will say, in terms of the information that they need regarding testing guidance for the remainder of this current school year.
Great. Thank you for not changing the guidance in these last few weeks of the school year. Really appreciate that. In our follow-up email to folks, in which we'll include the recording and the PowerPoint slides, I'll include the statement from the Department of Health leadership team acknowledging the publication of the new CDC guidance and that they don't intend to change any of the K-12 guidance for Washington State this school year. Heather and Michelle, will schools be required to do any testing next school year? Sports, performing arts, other specific populations?
Sure, Sarah, I think that was a really good question. I think in the last update, not sure if everybody saw that from March 2022, that latest guidance does share with schools that they are allowed to implement screening testing for athletic and performing arts to help them promote safer participation, but this is not listed as a current testing requirement. You know, with that information said, we will talk with our guidance team to see if anything changes, but that is the latest direction and guidance that DOH is providing for these particular activities.
Okay, yeah. I remember having a reflection about there's such a difference between required and recommended. So it sounds like right now that screening testing is not required, and until the guidance changes, schools should expect that to be the case. What about test to stay? We have a lot of schools on this call who have been offering the test to stay program to allow students who were exposed but don't have symptoms to return to the classroom. Will that be an option for schools next year?
Yeah, I'm going to reference what we currently have in our guidance right now, and I will say that's currently a recommendation. It's not a requirement, but it's still something that can be used as a mitigation strategy for schools to implement as they wish, in coordination with their LHJs.
Great, thanks, Michelle. So my guess is this next question is answered in the current guidance, but if you wouldn't mind just recapping for the folks on the call. Can you explain the reporting requirements for take-home tests? What are the requirements for, so if schools are passing out take-home tests to their community, do they have any reporting requirements for the results of those tests?
Yeah, Sarah, it's a great question too. I know this has been a really hot topic about what to do with take-home tests as they're being utilized more and more from schools. I don't want to spend too much time on today's learning network to go through all the different nuances, but I do hope that the interim self-testing guidance for K through 12 schools is shared as part of the notes here, because there's a really neat grid that was put together that really sums up the information that should be provided for schools in what scenarios that information needs to be reportable back to DOH and or their local health jurisdiction. So I really recommend schools ensuring that they have eyes on this guidance and then, following up with us if they have any further questions following their review of that information.
Okay, we will be sure to send that out, and thanks, Emily, for dropping that in the chat. Schools currently use Simple Report to report the results of their tests. They are required to report positive cases. They're not required to report negative cases currently. Do you expect that schools will be continuing to use Simple Report next year? Will reporting be mandatory? Will there be other reporting options available?
Yeah, thanks, Sarah. I would anticipate that we will continue using Simple Reports for the following school year. We don't see that will be changing. Incorrect. At this point in time, what we're recommending to schools as a requirement is to report positive cases.
Thanks, Michelle. And as a reminder to folks, your Simple Report account will deactivate itself if you don't log in for 60 days. So maybe log into it once before you leave for summer vacation, or set a reminder to do it before the end of those 60 days. Okay, why don't we jump, for the sake of time, let's jump over to the labor fund. And Heather, I know that you highlighted in your presentation that you're still working with the DOH fiscal team and other stakeholders to get all of these details. At the risk of redundancy, I will ask you a couple of follow-up questions. Will labor funding be available next year? Yes. Right? Okay. That was supposed to be a softball, sorry. Okay, question from a school leader. Can I expect the same amount of funding next year?
Yeah, maybe just to highlight some of the information that Heather had sent, the amount of funding that we're hoping to set aside to support FTEs and labor support funding will be roughly 2/3 of what we were able to support for this year. So recognizing that, I think it would be best for schools to share details of their request with us once we make that information available in mid-June about what those processes will look like, knowing that not all schools are going to ask for the same level of support for funding. Some may ask for more, some might ask for less, and some might ask for the same amount. I think giving that awareness to DOH once we've opened our processes up for sharing that information will help us gauge sharing more information back for those specific school districts requesting the same amount of funding for next year for our consideration and a continuation of their program.
Okay, so when you say that 2/3 of the funding amount will be available next school year, you're talking on an aggregate state level. You're not necessarily saying that schools should expect 2/3 of what they received. You have some flexibility, hopefully, to accommodate the different levels of need. Great.
Yeah, that's correct, Sarah. It's more of an aggregate level. It's unclear to us right now how many schools will be reapplying depending on their levels of support, but we have set aside a substantial amount of funding to support these efforts for schools, but we need to understand what those needs are at the individual school districts.
Okay, so it sounds like a give and a take, and that schools will be able to indicate to you how much funding they need. They'll be invited to indicate to you in about mid-June. Am I tracking this right?
Yes, we'll be sharing our process with them for those details in mid-June.
Okay, so to the folks who submitted the question, should I submit anything now? No, mid-June. Great. Will districts need to reapply if they are already receiving money?
I would say the answer is yes, just because we don't know how many districts will want the same amount of money for next year. And I think all the approvals for the amounts given to schools this year was meant for this year. So we'll have to, reevaluate what the needs are for the following school year.
Okay. And if there are folks who received funding this year and they haven't spent all of their funds, they can expect an extension of their spending date. They don't need to scramble to spend all of the dollars by July 31st of this year. Is that correct?
Yeah, that's correct, Sarah. And we'll be working with our OSPI partners and Martin on the call to really define what that process looks like. I know there's a lot more nuances there that we'll have to work out with the schools for ensuring that that money is being spent over a longer period of time. But that is the information that we're sharing with you at this point in time, that you don't need to spend out all your funds that you have available right now before the end of this school year.
Okay, that's helpful.
I just want to call out one nuance, Sarah, that we're anticipating that for those schools who currently have approved FTE funds and are looking to access FTE funds next year, they will have a different process than those who are looking to apply for totally new funds. Like we want to support schools who have existing infrastructure in place. They want to request the same amount or slightly less amount for next year. those are the processes that we're really looking to get out first, is for those schools who want to know if they can keep this person on through the summer and into next year. That's really what we're prioritizing for mid-June.
Okay, yeah, thanks for that clarification, Heather. For folks who have asked, I think this touches on the question, do we apply for the grant in the same way that we did last year? Based on everything I'm hearing, based on separate conversations we've had, I think the answer to that's no. It's going to be a slightly different process next year. One, so there's kind of these like pathways that folks can choose from if you have unspent funds, if you are applying for the first time, if you're reapplying for next school year. So I don't think the process is going to look identical to what folks experienced this past year. I see the question in the chat about how many districts participated last year. I don't know if any, do you know that?
We're seeing if we can get that number.
I think it's over 200.
Yeah, I'll say it's about 210, give or take a couple. And that represents about 2/3 of the total possible participants, given that we have districts, charter schools, and private schools, which is roughly 315 total. So, yeah.
Yeah, thanks, Martin. Shout out to Martin behind the scenes. He's the one who makes the money flow. Okay. When will the last quarterly attestation be due to DOH for the labor funds?
I think this was on Heather's slide, but I'm happy to reiterate. I believe we've requested that be submitted to DOH 2 weeks within July 31st. So that information should be sent to us no later than mid-August for the last quarterly labor attestation, since I think the last quarter ends at end of July 2022.
Okay. And if folks have lost that link for the quarterly attestation, feel free to email your Health Commons program manager and we can send it to you again. Do you all know, so this is a question that's separate of testing. Do you know if there are any other funding opportunities available to schools for other things like additional nursing support, PPE, contact tracing expenses?
I'll turn that one over to Heather for her response.
Yeah, it's something we're happy to keep exploring and sharing out with schools as we learn more. You know, for example, with PPE, I know that schools can work with their local health jurisdictions to access PPE. That's a part of the state stockpile at the Department of Health. So that remains a resource. I know that there was stood up some additional contact tracing resources. Happy to work alongside local health jurisdictions to identify either additional funding streams or additional resources. And I think that's also an area that we can keep working with OSPI and other partners to better understand what that ever-evolving funding landscape looks like.
Great. Yeah, and I don't know of any ready-made funding streams for schools to access for these items, with the exception of the support resources you named, Heather. It sounds like DOH and OSPI will be sending a survey out to school leaders. I wonder if there's a free text field in that, and this might be an area that folks can add, you know, highlight some specific gaps that funding isn't covering right now. Knowing that the results of that survey are primarily to inform the testing program, but if relevant to other departments at DOH or other state leaders, you'll disseminate those out appropriately. Okay, for testing vendors, testing technology, the menu that schools can order from, we've heard that DOH will be providing testing supplies next year. It sounds like you will transition to more of an emphasis for take-home tests and the rapid tests that folks can perform on site. Cool to hear that you're exploring the rapid molecular option. We've had a couple schools inquire about that. One school leader writes, our school uses a labor partner vendor. So that's CIC Health or BD for folks on this call who are partnered with them. Will they be available next year?
All great questions, I will say. Also part of the timeline, that's something that we're trying to figure out right now. We are working with our internal contracts team to figure out what the contracting requirements would be for external labor partners for next year. So the short answer I can provide today's call is there will be labor partners on the menu. There will be more than one that could be made available to schools for next year. Who these vendors will be, we're hoping to share those details in a couple months. So hopefully by mid-July, we should be able to share more information, but definitely before the start of next school year, it'll be clear which labor partners they can connect to continue testing support for their school or school district.
Okay. And if folks have follow-up questions about what it's like to work with a labor partner, which is like a medical staffing agency that sends trained staff to the school to conduct testing, you can reach out to your Health Commons program manager. They can walk you through the options, knowing that it sounds like their scope or their focus may be changing a little bit for next school year. But folks who are interested in learning more, reach out to your program manager. Knowing that you are still finalizing which of the testing technologies will be on the menu next year, what happens if a vendor that a school is currently partnered with is not available next year?
I want to say, I'm going to go back to something that we experienced maybe a couple months ago. I would say that most of our labor support partners should be pretty interchangeable. They provide the same level of services. So if it happens that either one labor partner is no longer on the menu, or if you anticipate needing to shift over to a different one, that I would anticipate that it should be a pretty streamlined process. I would recommend, working with your Health Commons program manager and really redefining what that could look like and how to reconnect with a different labor partner. But there should be a lot of resources available for you to have that support next year.
Thanks, Michelle. Okay, last question for you two, and then I'll take the last 5 minutes for an end of year review. Is DOH requiring any information from our school before we leave for summer break?
Yeah, perfect segue, Sarah. I would say that both Martin and yourself have alluded to a short survey that we're hoping to release to schools. And just sharing a little bit of background about what this survey is about is, this is an opportunity for schools and school districts to share direct feedback to DOH through the survey about, how did testing go for you this year? What are some highlights that you want to share with us, areas of improvement? And, looking forward to next year, how do you see the testing needs evolving based on the other resources that may be made available and in light of changing testing requirements? And so we're hoping that more communication about this will be shared about how to access and participate in the survey in the coming days, but really wanted to let you know this is our way of ensuring that we're hearing from all of you and understanding that as we build this Learn to Return menu of services, that it supports the needs of all Washington schools.
Yeah, I'll just maybe do an echo to the survey. It's completely optional. More than one person at your school can participate. We and know that our partners at Health Commons, at the ESDs and OSPI, they continue to advocate on behalf of schools across the state to inform how this program evolves over time. We wanted to create a direct connection with schools so that you can share with DOH, you have to have Binax now on the testing menu for next year. This really didn't work. I have this idea. We'd love to expand it. Like, this is one opportunity for you to share that information directly with DOH to really inform the details about what the program looks like for next year. We really want to maintain the overarching pillars of the program and minimize any disruptions. but there's a lot of room to grow and be more responsive to your evolving needs. So this is one mechanism to facilitate that input.
And maybe just one last point before we turn it back over to Sarah is, Sarah asked that question, are there any more opportunities for open-ended questions on the survey? And the answer is yes, understanding that you may have questions that are beyond testing. Some of them are guidance related or additional supports that you're looking for. Obviously, Heather and I only represent part of DOH and not all the other teams from DOH, but there is opportunity on the survey for you to express some of your needs there. And Heather and I will do our best on sharing that information across our DOH teams so that there's better awareness of what schools and school partners need.
Great. Well, Heather, Michelle, thank you so much for joining us today. I'm going to do a lightning round end of year review. Jordan, if you wouldn't mind putting up the slides, let the record show that I have always ended the Learning Network on time or before time, and today will not be different. Okay, next slide, please. 834 out of 850 school partners offered COVID testing this school year. We define school partners as school districts, private schools, tribal charter schools, independent schools, charter schools, all of it. 98, 99%, I can't do that math in my head, offered COVID testing to their school community this year, which is absolutely amazing. 69% of school partners enrolled in Learn to Return to get our support services over this past year, and it has been such an honor to serve all of you. Next slide, please. Here's a cool map of the geographic spread. Thanks, DOH, for putting this together. There's an interactive version somewhere online, too. I can find a link to that one. Next slide, please. We distributed 3.63 million rapid antigen tests. Huge thank you to the ESDs who stepped up during the Omicron surge to do a hub and spoke distribution model. Folks who have been in the ESD offices have seen boxes piled from floor to ceiling. So thankful to all of you for stepping up and making sure that schools didn't have testing outages. This number it's just absolutely huge. I don't have any positivity rate data on it because schools are not required to report their negatives. Next slide, please. So the PCR tests, we do have more data on because the lab does the reporting for the school. This is a chart from Curative. So this is just for the 100 or so schools who are using Curative, but you can see the Omicron surge there. Washington schools did 3,000 tests in one day during the Omicron surge, and the peak positivity rate was 35%. So you were finding COVID, and I will remind all of us that our schools did not close during the Omicron surge. Next slide, please. So for the schools who enrolled in Learn to Return, you've received different support from us throughout the past year. DOH has allocated over $45 million via the Labor Fund. It sounds like next year we can expect about 2/3 of that amount. 47% of school partners attended at least one Learning Network event. Over half of you are subscribed to the newsletter. We've offered translation services, access to toolkits, and other technical support from both Health Commons and the ESD coordinators. Here's a breakdown of how different schools have used different vendors. So you'll see nearly all of the schools who are offering COVID testing in Washington are using rapid tests, either the professional rapid tests that you do on site or sending take-home tests home with folks. Oh, I've been saying 100 schools using Curative, it's closer to 200. We'll send out these slides after, some nice light bedtime reading. Thanks for these photos from the ESDs. What these numbers don't show is all of the stories that I've heard over the past year, over the past 2 years. These numbers don't show things like Jeff Stepp, the ESD coordinator on the Olympic Peninsula, driving over 8 hours in a single day to pick up analyzers from the DOH warehouse and get them to a school during an emergency. This data doesn't show leaders at Renton School District. Laura Wittes, Ellendor, if you're on, you advocated for translated materials to serve all members of your community. This program heard that. We now translate our materials into over 30 languages to make sure that we're truly language accessible. Seattle Public Schools, Audrey Querns, Dr. Carrie Nicholson, Dr. Carrie Campbell, Dr. Sarah Pritchett, you all organized a back to school testing event during the last week of winter break. You had 100 volunteers raise their hand to host this testing event, and you tested over 14,000 students in a single day. Sonia Buchter from Enumclaw, you launched the first staff screening program in Washington State. Your first day of testing was the first day of winter break of 2020. It was also the first time that most of your staff got to see each other in person again, and it was a really amazing moment for me to observe. Lonnie Chafee and the team at Bainbridge Island, you launched a drive-through test site that is one of the primary sources of testing on the entire island. I have friends who live on the island who utilize your testing site. Kisa Hendrickson, Gemma Kim at Highline, you developed one of the first mobile testing programs in the state, and it offers truly equitable access to testing. Leaders at Kennewick School District, Brian, Lisa, you implemented one of the first test to stay programs in the state, and you created a public dashboard that highlighted how many days of in-person learning that program saved. I could spend this whole learning network event sharing these stories. I am so thankful for the hard work. I know that this is not your job. Thank you so much for serving your school community over the past 2 years. Our team will be available to you this summer for folks who are working this summer. We hope to be here in the fall to support you through the next version of this program. Yeah, thank you so much. We're dropping in the chat other success stories. We have pages and pages of these. Thank you so much. I don't think I can share the chat out afterwards, but a well-deserved summer from all of you. I can't share my gratitude enough, but really, really honored to be a part of this moment of history with all of you. Okay, I went over time, but I hope all of you have a great day, a great week, a great summer, and we'll see you soon.